Welcome again to Diabetes 180. This is the last of our 5-part series, how to get rid of belly fat and improve your diabetes health. This is my favorite part. I might have said that before, but this truly is my favorite part, exercise. I know you are waiting for this. I mean, you can't talk about getting rid of belly fat without talking about exercise. But I want to highlight how effective this tool really can be when used properly. The thing about exercise is that it has a powerful effect to increase your body's sensitivity to insulin, like better than medicine, because when you take medicine, usually it has an effect on the body for up to 24 hours or less. But when you exercise has an effect on your body for more than 24 hours. That means when you exercise on Monday, that workout is working for you on Tuesday and even into Wednesday to lower your blood sugar levels. So that's why it's so important to be consistent as a diabetic when it comes to exercise, because exercise is working for you, not just all day, but for multiple days, okay? So what's great about exercise is that it doesn't take much, okay? So there's 3 things I want you to do to maximize the effectiveness of exercise. Number 1, you should exercise within 60 to 90 minutes after a meal. Why is that? Is because when you eat a meal, what happens is, your blood sugar levels will start to spike within 60 to 90 minutes of eating that meal. So if you exercise within that time frame, what you're doing is you're priming your body's insulin to take that sugar after it's broken down through the digestive system out of the blood and into the muscles that need it. And it doesn't take long. You may say, well, I don't have time to exercise after a meal because I'm at work or I'm busy taking care of, things at the house or you're watching your kids. But it doesn't take much. Studies show, guess what? Just 2 minutes. Just 2 minutes, or obviously the longer the better, but just 2 minutes is all it takes to really experience the effectiveness of exercising after a meal. Every one of us has 2 minutes to spare, okay? Walk around your house for 2 minutes after a meal, if that's all the time you have for. But just at least 2 minutes, you can do it. The second thing to make exercise effective and maximize its power to reduce your belly fat and improve your diabetes health is to include weight training, muscle building weight training exercises. The thing is, most of us, we like to focus on cardio, whether that be running or cycling or being on a treadmill to lose weight. And this is good, but what most people don't know is that the more muscle mass you have on your body, the quicker and easier it is to burn fat. This is why men are more able to burn fat through their workouts than women are. We know this because, there's more than one reason, but one of those reasons is because men have more muscle mass. The more muscle mass you carry in your body, the more your workout will work for you in burning fat. So to take advantage of this fact, you have to be building muscle. The more muscle mass you carry, the more fat you'll be burning during your cardio sessions. I hope that makes sense. Another reason why it's important to build muscle if you want to burn fat and improve your diabetes health is because your muscles are one of the main places your body seeks to store glucose in the form of glycogen. Okay, so the more muscle mass you have, the more storage space for the blood sugar that you want to get out of the blood and into a place that's not causing harm and damage, like your muscles. So your muscles have, I guess you could say, they're like the cabinet space of your body. So the bigger the cabinet's space in your body, the more place for the sugar to be stored and taken out of the blood. So it's so important for us to build those muscles so that we have more storage space for our blood sugar. All right. So the third thing that you need to do if you want to maximize effective exercise is HIIT, high intensity interval training. HIIT. I encourage you to look it up and understand its effectiveness. Studies show that HIIT training versus steady state training, that's running for 30 minutes or walking on a treadmill for an hour, HIIT works so much better to burn fat. If you take a group of people who are doing HIIT training for 15 minutes and compare them to someone who was on a treadmill for 30 minutes, the group that is doing HIIT for 15 minutes will burn more calories in those 15 minutes than doing a steady state run or walk on a treadmill. The reason that works, I don't want to go too much into that because I want to keep this video short and simple, but look up HIIT training, HIIT. It's very simple to do. Basically what you're doing is you're going at a high intensity level for a short period of time. Let's say you're sprinting for 30 seconds, followed by a more steady state run for 30 seconds to a minute. And you're going back and forth, high intensity to moderate intensity, high intensity to moderate intensity. Do HIIT training, do it consistently, and you'll find better results than your more traditional steady state cardio training. All right, so that's about it. I want to summarize the 5 steps now. Number 1, get rid of sugar. Number 2, increase your fiber intake. So important. Number 3, drop your fat percentage to 15% of your total daily calories. Number 4, intermittent fasting. So powerful, so effective. And number 5, exercise. Follow these 5 steps. Follow them consistently, and you will find yourself losing fat in the places that seem to never go away, and you will find yourself reversing your diabetes quickly. If you want more videos like this, then like and subscribe. But I would also ask you a favor, because I want to make sure that I put out content that people want to listen to. So please leave me a message in the comment section about what you want to cover, something you want to know more about when it comes to diabetes or anything regarding your personal health. Thanks again for watching Diabetes 180. I'll see you in the next video.